So how do children get holes in their baby teeth, and why does it matter? By the age of 2, your child will have a mouth full of baby teeth. Many of these teeth need to last for 10 years or more. If your child has a sugary diet, that sugar combines with the bacteria in the mouth to cause holes in the teeth, or dental decay. The more sugar, typically, the bigger the hole. Sometimes these teeth crumble and need to be removed, but that's only part of the story. Underneath the gums are the roots of the baby teeth, and underneath those the adult teeth growing under them. If the sugary diet continues, then the hole gets bigger, and this can lead to infection and swelling and pain for your child, and sometimes damage to the adult tooth buried in the gum below. If that baby tooth needs to be removed, there can be crowding where the space closes over, and sometimes the adult tooth is even delayed in growing into the gap. So there you have it. For healthy baby teeth, cut out the sugar, and never ever put your child to bed with a bottle of milk, juice, or pop.